It's all yours.
Thank you so much, Giovanna, and thank you to the Harrison Library for hosting me and hosting Petula and Lisa. We're very excited to be doing this introductory fall workshop on caring for your feet. Our feet are our foundation and help us to sense and feel the surface, to move and provide balance while standing. They're also our connection to the earth and provide grounding. An agile, pain-free body starts from the feet up. The lower kinetic energy chain of the body consists of the feet, ankles, calves, shins, knees, thighs, hips, pelvis, and spine. All these parts of the body are interconnected and depend on each other for optimal functioning. You may remember the song, the foot bone is connected to the leg bone is connected to the knee bone is connected to the thigh bone is connected to the backbone is connected to the neck bone is connected to the head bone, and the reverse is also true. If you have a misalignment or injury in one of these body parts, the whole system can go awry. Our feet take a tremendous amount of wear and tear as they carry the entire weight of the body from years of standing, walking, and running. As we age, we also lose the padding under our feet and the springiness and bounce of our youth. Our ancestors and many of the barefoot cultures around the world have strong, healthy feet. Stuffing our feet into shoes, often ones that don't fit properly, and not paying attention to our feet can lead to problems over the years, judging from the huge market for custom insoles, the number of knee and hip replacements, and foot surgeries. One startling statistic says that by age 80, 1 out of 10 people will have an artificial knee. It's never too early or never too late to pay attention to your feet, to give them some tender, loving care. Spend 10-15 minutes daily on your feet, and you'll see the changes and improvements. And now I'd like to introduce Lisa Kinsman. Lisa is an American board-certified reflexologist who has been in practice since 2005. Her initial training was in Hong Kong, where she was, her initial training was in Hong Kong, where she was a school teacher at the British Military School. She did her professional training. She did a professional training. She did her professional training after moving to the US and has completed advanced studies both here and in Europe, including specialist training for working with pregnant women and Sloan Kettering protocol for supporting cancer patients during treatment. Lisa's personal story is that when she lived in Hong Kong, she came across a storefront that had a reflexology chart in Chinese in the window and noticed that they were working on people's feet. She'd been walking all day and her feet were sore, so she decided to try it out. She liked it so much that she went back several times. She was surprised to notice that her migraines became less frequent and she did not need her pain meds as much. This piqued her curiosity, and she decided to study reflexology and has been helping ever since. So now, I'm sorry.
Yeah, thank you, Usha, and thank you for sharing my screen and for that introduction. So that is my business on the screen there, My Soul Food Reflexology. And if we go to the second slide, Usha, as you mentioned, I began my journey towards becoming a practitioner accidentally after going into that little store one day when my feet were hurting. I did not understand the map that was in the window, except that it was an image of the feet with the organs of the body represented on it. Everything was written in Chinese, but I could see that people were receiving some kind of work on their feet, and they had their feet up, and that was just what I needed at that moment. So I went in. I really enjoyed the session. I felt my feet felt so much better afterwards, but my whole body felt more relaxed, and I was encouraged to go back. And over time, I was extremely surprised to find that my migraines were improving. Not a miracle cure, but certainly less frequent. The intensity was lessened, and just that curiosity about what was actually going on here. Nothing else had changed. The only thing that I'd done was be getting regular reflexology. And so that encouraged me to research it and ask questions about this idea of this foot map. And I began researching, and ultimately I decided to train to become a practitioner because it was so helpful to me. So if we could look at the third slide, please. What exactly is reflexology? Well, we know that there are therapies that have been practiced on the feet all around the world in different forms, but we believe that reflexology traces back to ancient Egypt. And that image you see on the screen is the earliest known depiction that we're aware of showing somebody receiving what we now understand to be reflexology. It's a therapy where we work on the feet using points that relate to the entire body. So yes, it does the feet good, as I discovered, but the goal, and more importantly, it does the whole body good to receive reflexology. And it is considered a complementary therapy in the way that it is practiced today. So not a medical one. So it may support medical treatment, but you do not have to be undergoing any kind of medical treatment or have a medical problem to receive the benefits of reflexology. So how do we think this works? So if we take a look at the fourth slide, there's a nice image there on the left from Laura Norman's book, Feet First, which shows in a very simple way how we understand the whole body to be reflected on the feet, with the head up by the toes, the spine down the middle of the 2 feet, the hips and pelvis at the bottom, and the limbs are actually reflected along the side. So the 2 feet joined together, representing the entire body, the left foot representing the left side, and vice versa. And on the right on the screen there, you can see a more detailed image of how a reflexologist would be thinking about the placement of the organs and the systems of the body when they are working on a client's feet and working through those reflexology points. So if we can go to the next slide, how does reflexology work and what does it do? Well, a trained reflexologist will use alternating pressure with just fingers and thumbs to those reflexology points on the feet with the intention of affecting a response in the body. So we usually see a response in the foot in terms of possibly a change in the texture, or if there is a slight sensitivity, we'd hope that by the end of the session that will have disappeared. But that would indicate to us that there has been some sort of shift, a change in the body. And very often clients will report feeling sensation in the body during a session. A typical one is feeling, hearing their stomachs rumble as the digestive system responds to the reflexology. So it's a little bit like a remote control. We're working in one place using pressure, but hoping and intending to affect something elsewhere. And we're not 100% sure about exactly how this works, although it's believed that there is overlap between different systems. We have thousands of nerve endings in the body that end in the feet, and we believe that some of the messages are transmitted through those nerve endings. Reflexologists work at the level of the fascia. If you were to remove everything from the body, all of the muscles, the bones, and just leave that membrane, the fascia that covers every single part of the body, you would still have a human shape. So it's also thought that some of the messages from the reflexology are moving through the fascia. We are also working on the circulation as we work. And although I didn't mention it there, and it's not my intention, my focus is that very anatomical reflexology map. We are also aware that there are meridians that end in the feet from acupuncture, and that there are many acupressure points on the feet that may also be implicated when you're receiving the reflexology work. And what does it do? Well, it releases tension both in the feet and the body, which helps restore balance throughout if there are blockages anywhere. It improves circulation and reduces stress throughout the feet and the body, which can in turn lead to less pain. It promotes very deep relaxation, both during the session. People often go into an alpha sleep-like state, but also afterwards. And that's one big reason that people come if they're having sleep issues. And overall, this leads to better function. A relaxed body that's free of tension and is well balanced is more likely to function well, and the systems of the body can do their job better. So if we go to the next slide, why do people come? Well, it's a variety of reasons. Like me, perhaps their feet are hurting. And certainly as you train, you learn an awful lot about foot problems, pathologies of the feet. And sometimes you may refer to a medical practitioner, a podiatrist, or to an orthopedist if you feel there's an issue that someone actually needs to have a medical diagnosis. We do not diagnose as reflexologists, but if we become aware of a problem, we will certainly tell someone that they should seek medical help. This is never meant to prevent someone from receiving medical treatment or to replace it. So even though sometimes people come with health issues, this is intended as a support that can work alongside whatever other treatment they may be receiving. It is never intended to replace it. And people do often come with things that they think may be assisted by receiving reflexology. I see quite a lot of pregnant women, particularly since I've trained in a protocol for the end of pregnancy called conditioned response reflexology, which is intended to assist women when they're going through labor to have a smoother labor and hopefully less painful one. Unfortunately, I see an increasing number of people who are struggling with chronic pain issues like fibromyalgia, but have found that they have some relief through receiving reflexology. And stress relief is a huge one, especially over the last year when we've all been under such pressure. With the COVID situation, I've seen a lot of people who are struggling to relax, and they find that this is a very gentle but powerful and non-invasive way to promote stress relief. Sometimes people just come because they're curious. Maybe they received a gift certificate, and that's fine. The best way to find out is to receive it. It cannot do any harm, and it often does an awful lot of good. And it feels good. So people come back because they know how good it makes the feet feel and also the body feel. So let's go to the next slide. What can you do to help yourself if you can't see a reflexologist or wish to support the body between sessions? I've used those slightly more simplified charts there that are based on the reflexology map that I would use with a client to come up with a little sequence that you can actually do at home. I mentioned in the video you're going to see using finger pressure, but actually when you're working on your own feet, you'll see that it's actually thumbs. I use fingers and thumbs when I'm working on a client. And you'll see me working on the feet between the diaphragm line, just under the balls of the feet, down to the line which is representing the intestine. And I explain why I chose that area in the video. So if we could maybe watch that one, please, Usha.
There are many areas that we work in reflexology to help stress in the body and to release tension, including the spinal reflexes, which encompass the nervous system, the head and brain, tension in the shoulders. But for this sequence, for self-help, I suggest working the area from the diaphragm line down to the area which represents the large intestine. Rest and digest, and you will find that the body will respond by releasing tension that you'll notice. So begin by sliding gently up 5 times. We call these the zones of the body. So you're just letting the reflexes know that they're going to be worked and also sending a message into the body. So just basically sliding. You can do it a couple of times each way. You may already begin to notice there are a few spots that are perhaps a little more sensitive than others. And then we're going to come to the center of the diaphragm line and gently put a little alternating pressure right in the center, where we would find in the body the area known as the solar plexus, which is heavily implicated in stress relief. And then working gently along that line under the ball of the toes, which represents the diaphragm. You can also do it this way by flexing the foot over one thumb, and that encourages the breathing to slow down, bringing a little more relaxation and calmness into the body. From there, you can gently finger walk using alternating pressure throughout all of the areas of this midfoot. And you will be then hitting on all of the reflex points that correspond to the organs and structures in that part of the body. So I'm currently working on my right foot, just up from the large intestine. If you refer to any of the charts, you'll see that I'm crossing over the kidney. And because this is the right foot, when I get to the other side, we'll be working on liver points, which actually is where the Chinese believe we hold anger. You can use finger walking, like an inchworm, or you can use thumbs alternating one with the other. If you find any areas or points where there is a sensitivity, you may wish to stay on that point and just press in and out, possibly with a circular motion, until you feel a release. Afterwards, you can once again slide all the way from the intestine line up to the diaphragm, and maybe ending with a little more rocking right there and the solar plexus point. There are many areas.
Okay. Thanks, Usha. So the next one is showing if it's difficult for you to lift the foot in that way, you can use a ball to work into the same area of the foot. I'm using a tennis ball in this example.
If it's difficult to lift your foot in the way that I just showed you, you can also work the feet by using a tennis ball. And in that case, seated, not standing because it's too much pressure, I suggest that you start by rolling the ball along the foot, up and down the same line as I showed you on the feet, and then following those 5 zones, up and down, you controlling the pressure with the body weight, more or less. As the foot begins to release, you may use a little more pressure if that feels good, but you should also begin to notice maybe that there are some tender spots. And then you can focus into each area with a pumping motion to mimic the alternating pressure that you might use with the fingers. Once you've loosened the foot, if you want to target a little more closely, and the foot is used to being worked with a tennis ball, you can actually move on to using a slightly smaller ball, like a golf ball, or even one of the little rubber balls that children sometimes have, the very tiny bouncy balls. But my suggestion for just relaxation and for stress relief is to stick with pumping into any sensitive spots with the tennis ball. And then again, you want to finish that session by gently rolling up and down the whole area, crossing those 5 zones, and maybe finishing with a little pressure just under the ball of the feet at the diaphragm line and solar plexus.
Thank you. And finally, there's a photograph of me there working on a client, and of the room that I typically see people in. We try to create a very inviting, soothing, spa-like environment. I usually work on a massage table, but if that's difficult or uncomfortable for someone to be flat on their back, then I use a comfortable recliner. It's very peaceful, easy to ventilate, which of course is incredibly important right now. And we can use a little lotion when we work, some essential oil, sometimes play nice music, just to create that atmosphere of relaxation and stress relief. and so that you will enjoy spending an hour of your time with your feet and doing some good for your body. And if you have questions or want to know any more, that's my information there on the screen, my website, and that's how people reach me for appointments. But I'm always happy to talk to anybody who wants to know more about reflexology. So thank you for coming today, and I welcome your questions when we finish the presentation. Thank you.
Thank you, Lisa. I would now like to introduce Petula Griffith. Petula is a registered nurse with 21 years of experience. She developed an interest in foot care when, as a bedside nurse, she noticed that patients could have benefited from additional foot care, such as trimming nails, removing calluses, and even addressing improper foot care. In addition, she has a family member with a family history of diabetes, and her grandfather had to receive an amputation due to lack of preventive care. Today, diabetes is an epidemic according to the World Health Authorities. In her White Plains office, Petula sees patients who come to her for foot care caused by diabetes and other illnesses, or from years of not paying attention to their feet or their shoes. She addresses the conditions that her clients come to see her about, and through her trained eye and a detailed medical history, she often picks up on other medical issues that need to be referred. As Petula says, the feet tell a story, and clients trust her as she's a trained medical professional. She also educates her clients on how to maintain healthy feet and to avoid serious issues related to the feet. Petula, it's all yours.
Thank you, Usha. As Usha said, I've been a nurse now for 21 years and took up the issue of foot care in 2016. As a bedside nurse, I realized the benefit of it as someone who provides private care in homes with companions. I often saw the need for the homebound client to have care of the feet where they could be provided with dignity, and also within their environment to remain independent. In 2016, I was able to go to San Diego and train with the veterans there in foot care, and came back, and in 2019 opened up my office in White Plains, New York. Today, I want to go through 3 points. I want to go through the importance of having good shoes. Oftentimes, shoes are our foundation. If you have good shoes, you would realize that most of the issues that you are experiencing would go away. As a nurse, our job is prevention. I want to be able to talk to you about our seniors as we are going through the pandemic, and also a few self-care tips that you can use at home in caring for your feet. In my first slide, I'm showing you that all feet do tell a story. This was my initial client. His name was Ben. Ben had a few issues, including rheumatoid arthritis going on with him. However, me going to attend to Ben was not his issues of the feet were not his primary concern. Me going into the home and going alongside him, I was able to support a 91-year-old man who was living independently, who was the primary caregiver for his wife. And his whole purpose was he needed to continue to be independent to do so. So each of us have a story with our feet. Our feet can talk about cardiac issues. Our feet could tell me, change in color could tell me that you're diabetic. The thickness on your toes, they can tell me that your shoes need changing. Something is going on. We all want to have a Cinderella moment. We all want that shoe that has the perfect fit. In my office, I provide measuring and foot tracing so that clients are able to identify issues that are coming up. They're able to see against a chart, why am I having a callus? Why am I having a cone? Here, after measuring the client's foot and doing the tracing, you would observe that the red outline is that of the client and the black one is that of her shoe. So this is immediately telling me, one, her shoe is ill-fitting, and she's going to soon realize why she was having some of the problems that she was having. This client presented with corns on her feet. I was able to show her, after we did the measurement, that the shoe size that you're wearing was too big for her feet and they were too narrow. Hence the reason you notice that the corns coming up on her pinky toe. To the right of the screen, you would also see corns coming up on the fourth, the third, and the second toe. And also too, you would observe that the toes are beginning to claw or to hammer in that area. As you know, as we get older, our feet change in size, weight gain with women, sometimes in pregnancy, and wear and tear of the feet take over time. Feet may become longer, they may become wider, and this happens after our ligaments and our tendons become a little bit more lax over time. Feet change their elasticity as other parts of the body do. The following slide, I want to show you an area of callus formation. If you would use your hands and feel the bottom of your feet, you would observe a hard build.
Hi, everyone. It does look like Petula might be frozen. We'll just give her a few seconds. Here we go. I think she'll probably log right back in, it looks like.
Okay. Should I go next and maybe we can have Petula finish up when,
Sure.
Okay. So let me actually start sharing my screen.
There she's back.
Okay, she's back. Okay, okay. So sorry. I'm trying to see how I can stop sharing, but I'll stop sharing. So Petula, are you back?
Did we lose her again?
It looks like it.
Okay.
All right, so sorry about that. And so I will share my screen. Hello, I am, let me just make it a presenter view. I am Usha Saxena, and I'm trained in Yamuna Foot Fitness and body rolling, and continue to study with other movement and bodywork professionals. The feet are always something I love to focus on, given my own personal history of bunions and knee problems. I ignored my bunions for years until they became painful and inflamed. I had difficulty walking and could not stand for too long. It was also a struggle to find the right shoes. When I started doing the Yamuna work, my pain and inflammation decreased, my posture improved, and I even lost weight and had more energy. My focus is on form and function of the foot and the body with the goal of building strength and flexibility to improve alignment in the feet. The most common ailments that I see in my clients are foot pain, bunions, Morton's neuroma, hammer toes, plantar fasciitis, fallen arches, loss of sensation, and poor circulation. So the human foot is a strong and complex mechanism containing 26 bones, 33 joints, and more than 100 muscles, tendons, and ligaments. Today, we're going to focus on the heel, the outer edge, the ball of the foot, and the toes. So here's a depiction of the human foot. These are the bones of the feet. And over here, you can see the muscles and the ligaments and the tendons. This is the Achilles tendon. So you see there are muscles that are coming in from the lower legs, and there are also muscles that are specific to the foot. And so you can see how many bones we have in the feet and the hands. These are tiny bones, so they compromise the majority of the bones in the human body. So any injury or damage to a small bone can shift everything. So these are the long bones or the metatarsals, which then attach to the toe bones, or what we call the phalanges. And this is the talus, which is sits on top of the heel bone, which is over here, and it's called the calcaneus bone. And you have here the femur and the tibia, which is part of the leg. So we're going to just start a simple exercise. And of course, you don't have to do this, but if you have if you want, you can stand up with your feet parallel, hips width apart, and then slump. Drop your neck towards your chest, drop your shoulders, chest, and head towards your hip. Stay here for a couple of breaths and let your body weight just collapse. Notice how heavy this posture makes you feel. Now keep your feet in the same position and press your feet into the floor and press your toes down with some extra force. Now inhale and lift up your body while you continue pressing your toes down. Notice how easy it is for your body to lift when your feet are engaged. So the heel functions as a launch pad. Bearing weight into it gives you the momentum you need to transfer your weight forward to all 4 parts of your feet. It's the largest bone in the foot, made to support your entire body weight. Years of shoe wearing have frozen most people's feet into a single unit, so they tend to stand with their feet shifted forward into the balls of their foot and toes. So when you have a moment, just stand up and shift your weight back to your heel and see how that feels. And then shift your weight towards your toes and see how that feels. And see what it does to the rest of your body. And also, what is your pattern? You could be more someone who's like used to standing and having your entire body weight more pushed into your toes. So we want to sort of like develop that balance and activate your heels so that your body weight is more in your heels, and that will also help you with your back pain if you have, or just being able to stand more upright. Now we're going to talk about the outer edge. The outer edge of your feet includes the outer side of the heel. So we think about the heel as 3 different points, or we actually have 9 points that we work. So it's the center of the heel, the outer of the heel, which is in line with the pinky and the 4th toe, and then the inner heel, which is in line with the big toe and the 2nd toe. So the outer side of the heel, the 2 outer long bones or the metatarsals of the outer edge of the ball of the foot, where these 2 bones then attach to the 2 outer toes. The outer edge also has padding and cushioning that cushions it as it transfers the weight to the ball of the foot. So this, if we look at our hands, it's very similar. So this is the ball of the foot, and this is the padding. Most people, what happens is that the padding starts oozing out. And so that makes it very uncomfortable for you to walk. Most people never use the outer edge of their feet when they walk, and all the weight is on the inner side of the feet. which is not able to take the amount of weight. So if you think about your hand also and sort of think about that chopping action, this is our strong side in the hand. Same with the feet. And you really don't have that much strength in the inner side of your hand. So I'm going to show you, this is the bones of your feet, and the darker shaded areas would be the outer edge that we are talking about. Also, some people call that part of the feet the heel foot, and then this is the ankle foot. And this is the foot that gives us the strength and movement. And this one gives us more of the flexibility, so we can kind of get the balance. So it's the human foot is designed so beautifully. Now, the ball of the foot. The ball of the foot is where the weight is transferred from the long bones into the toes. Most people's foot joints have lost their flexibility due to being stuck in shoes all day and never stretched. These joints then become immovable and can calcify, harden, and become arthritic. The padding also starts oozing out as from excessive weight bearing. So the bones will wear out without the padding. It also makes it hard to wear high heels without the padding. The toes. Your toes are essential for walking, standing, and balance. When your toes lack strength, they cannot support the body to be upright. The toe flexibility enables the foot to roll through them during the final part of each stride. The toes must be able to bend at each joint and have the strength to support the foot in its forward movement. So if you see an elite athlete, a runner, you will see they kick off, and then the heel comes forward first, and then they use all parts of the feet, and then they use the toes then to kick off to then lift the back leg forward. So that gives them the momentum. So now this is a look at the baby's feet. So you can see the beautiful padding. The toes are all wide and spaced apart. And also the baby has the ability to use all of the toes. They haven't been stuffed into shoes. So one of the things, if you find that the spacing between your toes is getting narrower and narrower, you could also use the yoga toes, which you can find. And I think there are many different varieties of it, but don't overuse it, just follow the instructions. So we often see a lot of misaligned gait. And it's becoming very popular now, the gait analysis for athletes. So we see a lot of times people go from their heel directly and shift their weight into their big toe. And that was some of the things that Petula was also showing in terms of the calluses. And that gives you some good indication. And you're putting a lot of stress on that joint. And that could also cause bunions. The other thing you see is people just like when they're walking, they're slapping the whole foot down, they're shuffling, and there could be different reasons for that. And inside walking, what Yamuna calls inside walking, where they're just walking on the inner heel to the big toe. Here's a picture of an athlete running, and you can see, so they're kicking off from the back foot, their heel is down first, and then their foot is aligned, and then the toes come down. So now we can do a few simple routines. The walking test is a test. This is something that we use both as an assessment to see what you need to work on, as well as after you've done some of the routines to just see what improvements you've made. You could also just do it as a walking meditation. Then you have the power stance, which is focusing more on the outer edge, and then waking up or activating the heels. And the last thing is the toes. We always seem to forget our toes because they're stuffed away in these shoes. So I've recorded a few videos. So here's the walking test. The right foot, heel forward, go to the outside edge of the heel, roll forward through the ball of your foot to your pinky. Always keep your knee bent. And now bring down your fourth toe, the third toe, the second toe, and the big toe. Now, left foot forward, heel foot first. Roll to the outside of the heel, edge of the heel, to the pinky, and then bring the pinky down, the fourth, the third, the second, the first. And continue walking and notice what is your pattern. Is there some part of the foot that's not working? Are a couple of the toes not working independent of each other and coming down together? Do you tend to collapse from the heel into the ball of the big toe, which is a common pattern and causes a lot of stress on that joint and leads to bunions? The right foot. Now we're talking about the power stance. The power stance. Stand with your feet hips width apart. Make sure that your heel is lined up with your pinky. Now bend your knee. We're going to work on the right side. So you're going to shift all your weight to the right side and make your left side light. Bend your knee on the right side and shift your weight to the outside edge of the heel to the pinky, and lift up all of your toes and bend your, so with just the pinky on the floor, and bend that hip on the right side out a little bit so you're bearing more weight on the outside edge of the right foot. And now slowly bring your toes down one at a time from the pinky to the fourth toe, the third toe, the second toe, and the big toe. And now you repeat the same thing on the other side. You lighten your right foot and shift all of your weight to the left foot. The power stance. So you might want to also use a chair or a wall for support when you do some of these actions. And here I've shown you a couple of things for the heels. I'm sitting at the edge of at the front of the chair, and I have one foot forward, and my heel is on the floor, and the ball of the foot and the toes are up. I'm making sure that I'm on right on the center of the back of the heel, and that my ankle joint is in line with my knee joint. And now I am going to rock forward from the heel to the ball of the foot, and then slowly bring my toes down one at a time, starting from my pinky to my big toe. And I'm going to keep doing this a few more times to activate and stimulate the heel. So once you're comfortable doing that and making sure that your foot is in alignment, you will then go to the outside of the heel. You could also use your hand to put in more pressure onto the heel where there's more weight into the ground. And you want to bend your knee out, and now you're going to be on the outside edge, and you take any padding in there and you tuck it in, and then you rock back. So you do this. So you're now stimulating the outside edge of the heel. And notice which part of your leg muscles are working as you do both of these routines. Thank you. So before you start working on your toes, so what you want to do is you actually want to push the padding that's just below your toes away from the toes into the ball of the foot. This is really important to get the toes to be more active. Then you start with any toe. Here I'm picking my pinky and I'm pressing in. I'm making sure that I'm pressing in to the whole toe, aligning it and straightening it, and even pressing into the nail. And I keep working each toe, and I keep making sure that I'm
realigning my toes and straightening out each joint. And so I get to the big toe. So now I notice that the big toe has the padding is spilling out and it's leaning in towards the second toe. So I'm going to take the padding, tuck it under the toe, and I'm going to hold on to the joint of that toe, and I'm going to move the toe away from the big second toe, and I'm going to keep pressing and insisting and staying there. So then after you do it and your toes get stronger, you could also like just hold on with your hands, both your hands onto the toes, and you can add the heel lifts. Press into your toes and bring your heel up, and you lower your heel. And the other thing that you can do is you can just like use your hands. And so you're going to flex your toes, and then you're going to point, flex and point. Again, just work gently because everyone is different. You could have joints that have become calcified and hard, so you don't want to put too much pressure, so you work at your pace. So before.
So here's just some more information if you're more interested in this work. And we are trying to do things without props with Yamuna. Yamuna has the foot wakers, the sole savers, and sole healers. But now she's got a book called the Foot Fix book, which you can purchase. You could work with a foot fitness practitioner. You can take an online class, you know, if you have some of the products, or there are also propless foot fitness classes. And you can always contact me at the information below. Thank you.
Thank you, Usha. We're going to go back to Petula's talk.
Thank you. Before I got cut off, we were dealing with the areas of hard skin. We were looking at the hot spot areas that may be a direct consequence of the shoes that we are wearing. The edge of the toes, the big toes, the little toe, the heels, the ball or the forefront of the foot. Here we have an actual client that we are seeing those areas that are very pronounced. If left untreated or unchanged, this can become a problem. You can fix this by introducing your feet to exercises, as Usha was explaining with the Yamuna method. You could also get physiotherapy and also to the exercises that were introduced to you by Lisa through reflexology in changing the gait and how you walk, and also changing your footwear would also allow you not to have these issues to reoccur. I move on now to the issue of seniors. Have you checked on your elderly relatives or friends lately? Right now, we are currently going through a pandemic, and what I'm seeing in my office and in the community is that our seniors are self-isolating. Appointments are not being scheduled as quickly in some offices, and you know, there's often some type of neglect that I'm observing. I want to encourage you today to examine the feet, take off the socks, take off the shoes, pull the covers and see what's going on with their nails, see what's going on with their skin. The following slides, I'm just going to quickly show you some of the things that we are seeing in the community and in my office. We have elongated nails. We are seeing macerations between the toes, which is due to moisture, hidden wounds, unattended callus formation. You could see to the right with the correct tools and products, we are able to remove it. We are seeing thick nails, dry skin to the left, resulting in cellulitis to the right, which is an infection of the skin, which will be observed by redness, often by redness and pain. The following slide, We are observing infections that are requiring hospitalizations. These things can be avoidable. On the left, we are looking at a case here of possible osteomyelitis, which was a result of somebody at home or caregiver trying to do foot care on a diabetic who has neuropathy. On the right, we have a client with cellulitis. I came into the home, the client was seen by his physician 2 days before and did not say to the doctor at that time, this is a problem that I'm having, because he felt that he was there to deal with another issue. So we have to encourage them to speak up. This again is another avoidable situation. We have issues of neglect in the community, self-care deficit, maybe someone can't reach their feet. This is nothing to be embarrassed about. This is exactly why I am here, to be able to offer the service that is necessary to turn things around. This client had a history of neglect because they were not able to get the appropriate foot care. If you look at the bottom of the slide, the skin was cleaned up, the nails were debrided or debulked, and the client within a few weeks was able to have her nails done. We were able to put a prosthetic over the nail, an enhancement, and she was able to put lacquer and have a moment with her family. Foot care is collaborative. I provide preventative foot care. If you come into me and there's a situation that is identified that requires additional help, I am able to reach out within the medical community, often getting same-day appointments. And also, if we can't get a same day, oftentimes within the week. What can you do at home to take care of your feet? I want to encourage you to inspect your feet daily for any objects or unidentified objects or pins or debris that may get into the shoe or to your socks. Wash your feet. Use cool or tepid water. Dry carefully between the toes. That's important to prevent macerations. I want you to use powders, gels, or foams. Do not use cream between the toes, because that will create, again, an environment of moisture. Moisturize your skin. Use a moisturizer of choice, a moisturizer that you like. It is best to use it twice a day, but if you can't keep up a twice a day regime, try to do it at least once a day. Consistency is the key. Change your socks daily. Alternate your footwear. Spray shoes with a disinfectant spray and air dry them overnight. This will address bacteria. It will also address odor. Change your insoles every 3 to 4 months for shoes that you're wearing regularly. I believe that all feet are beautiful. If you have any further questions, feel free to reach out to me in the chat afterwards. You can certainly email me at the Foot Care RN or call me at the number that you see on the screen. Thank you.
Thank you.
Thank you. And I think we have some questions. So Petula,
Yes.
and I've started noting down some of these questions so we can answer them. And then if we haven't covered all of the questions, you can also reach out to us through the chat. So there was one question about neuropathy.
Yeah.
And that, yes, I think all three of us see clients who have neuropathy. Lisa shaking her head. I'm sure Petula sees this all the time. Yes, as Yamuna practitioners also, we have worked with clients and they regain sensation. So it's very important if you have diabetes or you have other circulation problems to take care of the neuropathy. And because if you lose that sensation in your feet, you're likely to have falls. One simple thing, I mean, is even just like scratching the bottom of the feet. I'm not saying that if you have serious neuropathy, it's going to, but we're also talking about preventive things. So we want to be able to for our nerves and our muscles and bones, everything to be working together. Lisa and Petula, do you want to share anything about neuropathy?
Well, in terms of reflexology, I actually have seen a lot of clients with issues related to neuropathy, whether it's as a result of maybe having chemo or, as you mentioned, diabetic feet, another problem. The only honest answer to give is that with reflexology, you need to try it to find out if it's going to help. I have had many clients who have been helped. We believe that that gentle pressure through the nerve endings helps just reactivate nerves that have become damaged or desensitized. But in order to find out, you really have to try. So that's the only thing that I can say. And I always encourage people, if it is a medical issue, that they do tell their doctors. I don't think I've ever had anyone who was discouraged from doing or trying reflexology. In fact, more and more the opposite is true. But I always like people, if they actually have a medical issue that they are being treated for, that they make sure that their doctors know that they are actually having reflexology. And it's helpful as well if the doctor discovers that it's helped them. But yeah, we do think that there is, for most people, some improvement, and definitely no downside. It's a very gentle way of stimulating the nerves and hopefully benefiting conditions like neuropathy.
Okay, great. Thank you. So the next question is about bunions. And the question is that they were told that this was hereditary. And yes, it can be hereditary, but it can also be caused by tight-fitting shoes. Petula had a slide, which I think we took out, which really describes how when you start narrowing. And Petula, you want to talk about bunions and wearing the wrong shoes?
Oftentimes, especially in the US, we are wearing a lot of convex shoes. When you wear these shoes over a period of time, you change the formation of the feet, creating bunions. So once this starts to happen, you want to be able to go ahead of it. And oftentimes, I have a shoe here. You want to be able to wear a shoe that is more rounded, that will allow the toes to relax and to avoid that shaping of the toe in this direction.
So Petula, when you say convex shoes, I think what you're referring to is the pointy shoes that are very fashionable.
The pointy shoes, the tapered shoes that we are wearing. Oftentimes people may not have a wide width foot, but they may have a wide forefoot.
Okay, great.
Oftentimes when we say hereditary, it is hereditary because we inherit the practices of our parents.
Right. So there's also a question here that can bunions be reversed and or surgery avoided? I personally avoided surgery. My bunion, so from a cosmetic thing, you can still see that my bunion is pretty large, but I don't have any pain. I don't have any inflammation. If you catch it early enough, so which I didn't, and you can actually read in Yamuna's book, but she also had a very specific 3-week class on bunions. So you can absolutely work on the bunions, and that is something that we are trained in, and we have had success. So the earlier you catch it, the better chances of you fixing it. But I've also worked on a 75-year-old woman who had bunion surgery in both her feet 20 years ago, and the bunions came back, and she found that the work was very helpful. It's just a question of keeping up that, footwork every few days, especially if you have issues. So now this is a question for Petula. What is an example of a disinfectant?
I keep it in my office. I keep it at home, Lysol. Any disinfectant spray that you have your shoe, you go in, you leave them to air dry. You put it at the window, you can put it at the door, you wipe it out, you alternate, and you're ready to go again.
Okay, thank you, Petula. We have another question for you about brittle nails as people age. they start noticing. And this one person, I think, said that they go to see a podiatrist quite often. No, that was actually so this is just about brittle nails.
Yeah, as we age, our nails tend to change. Your nails may become brittle and nails may become thicker. This might be due to circulation. If there's an issue with the brittle nail, oftentimes I would refer you to a dermatologist to be able to examine it. If there's a nutritional deficit, the doctor can be able at that point, if he wants to do blood work, and guide you accordingly in what to do. But brittle nails does not mean, okay, I'm getting older, my nails is brittle. Your brittle nails may be because of infection. It could be because of psoriasis. There are a host of different reasons, and that has to be diagnosed.
Thank you, Petula. Now we have a question for Lisa. Is some form of reflexology recommended for hypertension, edema, and Alzheimer's dementia? Patient sees a podiatrist 6 times a year. Oh,
We
Lisa.
need you to unmute.
I'm sorry. Yes, I have worked with people with hypertension, particularly, even as a volunteer in hospital, which has been quite interesting when people's blood pressure and so on is being monitored. Edema, you do have to be a little careful, and definitely for that, I would want permission to work on somebody from their doctor to say that it was actually okay. That is one of the few contraindications unless we're given permission. I have worked on people with Alzheimer's. By and large, it's been found to be helpful, soothing, especially in cases where people become agitated. It has been tricky on a couple of occasions where the person hasn't really understood who I am, has been a little nervous. But once I've been able to start and it's found that the person is, enjoying it just like anybody else would and is beginning to relax, then usually it's been okay. But they sometimes need a little support, maybe somebody with them that's familiar to them, rather than just, someone working in and touching their feet. That can be a little confusing if they don't understand fully what's happening.
So thank you, Lisa. So now there's a question about gait assessment. And since I had that slide there, and the question was, don't you need a doctor to diagnose this? No, that is actually part of our training. We have very rigorous training. We have to do a lot of case studies. We always look at people as they're walking, we film them. We also look at their posture. This gives us a lot of clues. Maybe it is your hip that could be causing the problem or vice versa. So I'm not only trained in the foot fitness, I'm also trained in the body rolling protocol. So depending on what we see, we might address another part of the body. Another question here was about the outer edge of the foot. What can be done? Can inserts correct it? No, I mean, the more you continue to strengthen the outer edge, and if you have trouble balancing and standing, use a wall. And you can also try the walking on the outside edge of your feet when you're in the house. And if it's hard, just walk on a carpeted surface. So I gave one client who was, again, the elderly client, I said, just use the edge of the carpet. And so make sure that the heel to your toe stays in line, because she had trouble balancing and was all over the place. Personally, I went to see a very famous foot doctor. I was given inserts. I spent maybe $1,000 out of pocket, one for my sneaker, one for my dress shoe, and one for my regular shoe. And I didn't like it. It was really uncomfortable. And when I started working the Yamuna, I was actually training, and I realized I didn't need it anymore. And I've never used insoles. So maybe I used it for a month. So you can absolutely correct some of this. And then there's questions about plantar fasciitis. And again, we all see clients with plantar fasciitis. In the past, I think, it was mostly women, pregnant women, who were being diagnosed with plantar fasciitis. And it could be the weight gain in the pregnancy. And often you see that it's the inside of the foot, right before, in front of the heel. But now we're seeing it in men, very athletic men. And, so I think a lot of it is, again, where are they weight bearing? And you are putting repeated weight and trauma to those, the fascia. And that's the connective tissue. And so that also causes pain. Petula and Lisa, do you have anything to add to that?
It's by far the most, let me, I'm unmuted. Yeah, it's by far the most common foot problem that I come across in my work. Some people don't even realize that that's what they have. But so as I mentioned, we consider reflexology to be a practice of the body, but we're on the feet. So we learn a lot about pathologies of the feet in training and also with clients. And we work at the level of the fascia. So yes, we often have people who come in with plantar fasciitis and find that it has helped. But going back to what Petula said, it's incredible how often it turns out to be a shoe issue. And people notice it getting worse at different times of year. I often have people who will tell me, oh, it doesn't seem so bad in the winter. And then you say, do you wear flip-flops? Oh, yeah, all the time in the summer. And that often is a trigger that they hadn't even realized. And unfortunately, plantar fasciitis doesn't necessarily show up the minute you're in the wrong shoe. And so people don't always associate. It takes a little time before it begins to become problematic. Or maybe they only feel it in the morning and think it's better during the day, which it actually, truly, it isn't. But there are lots of reasons that people don't address it immediately or don't realize the cause. But I think Petula perhaps has something to say there about the shoes. But yes, I do see a lot of people, and they've been helped in general by receiving regular reflexology.
In healthcare, especially as a nurse that has been on the floor, oftentimes we pick it up. You pick it up in the morning, it's a very painful situation. Once it is identified, again, my job is to be able to identify. And when it's identified, I'm able to refer the client. Oftentimes, the client may even say, you know what, I've been suffering with this and suffering. And I want to say this, a lot of people have been dealing with pain for a very long time and accepting of pain. So they need a diagnosis, what's going on. So again, you are going to be referred to the podiatrist to get a diagnosis. Once a diagnosis has been received, I oftentimes refer. Do you want to do physical therapy? Would you prefer to go to a foot fitness expert like Usha to do the Yamuna method? Would you prefer to reflexology? There are so many options now in getting things done. Orthotics is not the end all because you're still not addressing the issue.
All right. And I think one of the things is if you just keep working on that outside edge, and also when you wake up, you could be lying in bed, work on stretching your toes. You could also move your toes in different directions. So the fascia is sort of like a web that connects the whole body from the feet up and reverse. They're now calling it an organ actually, and it's like what holds us, the container, right? So it could be that you work on the feet and you're affecting other parts of the body as well. So absolutely, there are ways that we can help you with the plantar fasciitis. So now, Petula, this is a question for you. Does wearing socks at night while sleeping, is it good for the feet?
It's good for the soul. If you want to wear socks at night, go right ahead. I would encourage you to moisturize and put those socks on.
It's always good to keep the feet warm. You want to maintain good circulation. And if you have a tendency to cold feet, I say, yes, keep them warm, keep the socks on. Or my favorite, use a hot water bottle in the bed.
Right. But on the other hand, if you're someone who sweats and you end up with and depending on what type of socks, Petula can talk about that, that will retain the moisture and you can start developing fungus in your toenails, correct?
Definitely. I would want to inquire from the person, why are you asking the question about wearing socks at night?
Yeah.
Are your feet cold?
Okay, someone has their hand raised. So shall we allow them to ask the question?
Definitely.
My question is, are any of the services covered by insurance plans?
Certainly in New York, reflexology is not, because it is not it's not a medical treatment. So no, I don't know about Yamuna. I'm guessing Petula is yours. I don't know.
No, nursing services for foot care are fee for service.
And the same with ours. But I think, again, there are a lot of classes that you can join, and you could also buy the book and, and try to work on the Foot Fix program. Of course, if you have any questions and you're frustrated, you can always reach out to me.
Is it considered cosmetic?
Which one are you talking about?
Doing anything for the feet, whether it's a bunion or dry skin or whatever, is that considered cosmetic?
No, it's not. A bunion can never be a cosmetic issue. For the person, perhaps when dealing with a bunion, oftentimes a doctor may say if you're not in pain, they wouldn't touch the bunion. If you find that the deformity is not pleasing to your eye, at that point, it becomes cosmetic and you can ask the doctor to shave it or remove it.
Yeah, so personally in my situation, I couldn't lift my big toe and I had a lot of pain, and the bunion, I prevented me from wearing most of the shoes. So I went to a foot surgeon in the hospital for special surgery, and they said that they would have to actually pull that toe apart and then put a pin. And I just didn't want a metal pin. I went to a foot doctor who used ultrasound, because all of these things are covered the way they are today. I mean, preventive care or yoga or reflexology can help you avoid these things, can even help reverse some of these conditions. But unfortunately, insurance companies don't cover this. I personally preferred not to have surgery, and that's why I opted on learning and doing this myself. And I'm glad I didn't. Hope that answers your question.
Thank you.
Do we have any other questions?
There was a question about what is a bunion?
Okay, so Petula, do you want to talk about it, or do you want?
A bunion is it's a deformation of what we call the metatarsal pharyngeal joint, which is the joint, that medial joint of the big toe. And that is usually caused by ill-fitting shoes. Once you have shoes that are tight, it forms pressure and it causes that constant movement of the joint, which eventually fuses in that place.
So what happens is also, it's not just the shoes, it's your gait pattern. So if you tend to collapse more into the inside. So, and there's a bone here. So you're like slapping down, putting a lot of pressure. So that sort of, you start developing bone spurs, it starts growing. And then that big toe starts like narrowing in towards the second toe. And then you can start developing arthritis, inflammation. So that's what bunion is. You'll notice anyone, I have a very pronounced bunion on my right foot. So it's like a bulging thing. I hope that helps.
Usha, I just wanted to mention, there was a question on neuropathy and the mention with the socks. And when I did ask, the person says, yes, are your feet cold? Things like neuropathy, I know, Lisa, you talked about it. I don't know why the client has neuropathy. everything has to be explored as to why. If you're diabetic and you have neuropathy, the neuropathy is associated with your A1C. If your sugars are not controlled, the neuropathy gets worse. If you have a back issue, you have a herniated disc, you have something going on with the spine, that too can also increase your neuropathy. So everything needs an exploration. We have to question before a treatment plan can be put in place. The person that is inquiring about socks in the night, even though I say it is good for the soul, which it really is, I would want to find out more. What is going on with you? Why are your feet cold? Is it a circulation issue? Do you have Raynaud's? What's going on? Why are you wearing this sock?
Thank you. I think there's a question here about what about toes that start to overlap? Is this due to shoes? Yes, it's partly due to shoes, but there are also, I've heard a lot of clients say, my mother had the exact same feet. So there is always a hereditary component to it. And if you remember the toe exercise, and I know it's a lot of information we presented today, where when I sort of say start with each toe and press into the toe, you also want to start like elongating the toe, lengthening it out, and aligning it. So if it is narrowing in, so you want to straighten, but you want to focus. So this is the long bone. So you want to line up your toe to the long bone because it may be completely misaligned. So you want to first bring it in alignment and then you press and you can start, with each part. So that the thumb only has these 2 joints, but all of our other fingers have 1, 2, 3 joints. So you can press at each point of the toe, and it takes work. But if you have something that's troubling you, start early before it sort of calcifies, and then you can't fix it without surgery. Any other questions?
We have someone with their hand raised.
Okay.
Could you tell me, is anybody affiliated in this group with a hospital in Westchester?
No.
No, I'm an independent practitioner.
Thank you. And bunions, aren't they always hereditary?
No.
No.
Sometimes.
No.
Well, a doctor had told me that was the case.
Not always. They can
No,
be,
it's
but
not.
always.
So we probably,
yeah, go ahead.
no, I was just going to say, we probably have time for one more question and then we can wrap up this session. And if this is a program of interest, it's something that we can offer again online for the time being and possibly in the building in the future.
Yes. So does anyone have a question?
Thank you. Okay, this was great. This was wonderful. It really was. And thank you to Usha for approaching me to do this type of program, and to Lisa Kinsman and Petula Griffith for sharing your expertise with us today. And I think you'll have questions coming your way after we get off the Zoom call, but we hope we can do this again. So stay tuned, everyone, and we'll give you the details once we have them. So.
And we do encourage you, Giovanna, would you be open if they had questions that they can send it to you and you
Sure.
would send it to us, and we will try to get back to you if you share your email. We're here to help. We want everyone to have happy, healthy feet.
Exactly. Healthy bodies too.
Right. Start from the top up, right?
Yeah. The feet, the foundation of everything.
Sure. So
Thank
yes,
you for having us.
thank you.
Oh, and there's one last question here. Someone wants to know if there's a liquid to use topically for thickened nails. So,
No, there's not a liquid to use for thicker nails. At my office, I use a podiatry file, and we use different grits of bits that are able to reduce that nail.
Petula is fabulous. I have to attest to that.
Oh, another question. I think that's what can someone eat to
Oh.
prevent or improve brittle nails.
Again, the issue of brittle nails comes up. The nail has to be assessed. We don't know why you have a brittle nail. You may have a brittle nail due to fungus. You may have a brittle nail due to a disease process. You may have a brittle nail due to a deficiency. An assessment needs to be done, and then a treatment plan can be put in place.
Yeah, and also wanted to add, since someone, I had asked about, the medical profession and if we're affiliated with a hospital. I have to say that I have a family member who has a history of diabetes, probably never went to a podiatrist except when they had some problem years ago. So Petula saw this family member twice in 3 months. There was a foot nail that was damaged 20 years ago and had stopped growing. 3 months after Petula started working the second time, we noticed that the nail was growing 20 years later.
Oh.
And, I decided I'm going to go and just have a preventive session with Petula. I had been to my podiatrist, but I have to say the care that I got from Petula was 1,000 times better than, and I'm not saying that my podiatrist wasn't good, my podiatrist was good, but they only have a limited amount of time. And it's what the insurance companies will allow them to do. And so if you can afford it, I think, it pays to invest in foot care, and you will avoid problems, later in life.
Thank you, Usha, for that mention. I also want to say I'm very happy to see the person who is talking about nutrition. I am glad that they're looking at an alternate way of getting the body healthy and to improve their nail health. And that too is very important.
And although we are not affiliated with any hospitals, there are definitely more and more hospitals that are offering complementary therapies, particularly reflexology. One of the trainings that I did was from Sloan Kettering, who offered a training for reflexologists in the protocols that they would like us to use with people who are undergoing chemo as a way of supporting patients to manage the side effects and so on better. And also at Greenwich Hospital, which is not in New York, I've done a lot of volunteering there, giving reflexology to patients in that setting. But in terms of affiliation, no, but more and more hospitals are seeing the benefit in using complementary therapies to support patients. So I hope that will continue and will increase.
Do hammer toes always require surgery?
Again, hammer toes. So again, it depends on how calcified that joint has become. So if you can work on it early on and also change your footwear so that you have a wider toe bed, you will start seeing improvements, but it requires work and dedication.
There are some hammer toes that do require surgery. I know that my son had a hammer toe and we took him in for surgery. So there is a benefit to it if you're diabetic and you have the tendency to calcify and to ulcerate on that toe. The benefit would be to shorten that toe to avoid that calcification and ulceration returning. In relation to are we affiliated with a hospital, or am I affiliated? As an independent practitioner, I'm not. However, I do get referrals from physicians and I do refer clients back into the hospital system. Recently, at least last year, I was able to do end-of-life care for 2 of my clients who were hospitalized within the hospital system.
And Petula, you have been an ICU nurse, right?
Yes, I have been.
So you have. So hope that helps. I think there's one question about doctors said to take biotin to improve nails. Petula, do you have a response to that?
Biotin has been done for nails, done for hair. if your doctor is telling you to do that, then I would say then you go ahead with the doctor's advice.
Mm.
And not just a doctor, your doctor.
All right, well, it's 5:26, so we'll close up the program. It has been recorded and will be available on the library's YouTube channel if you missed any portion of this. And we will work on getting a part 2 of this program as well.